For staying with us, this is ENCA. We continue with our rolling coverage of COVID-19, and we start with this, where the country is trying to adjust every single day to the new realities that the coronavirus pandemic has brought. So what about the viability of donating organs if the donor had the disease? One particular concern could be the transplant recipient's susceptibility to infection. But joining me now to give clarity and to discuss this even further is the South African Transplantation Society's David Thompson. David, thank you so much for your time. Let's talk about, the viability, I suppose, of organ donors who perhaps have had contracted coronavirus previously and now had recovered, are keen to, donate their organs. I mean, would their organs still be considered?
Yeah, so patients are expected to make a full recovery after having coronavirus. The issue would be for transplantation in that all recipients get immunosuppression, and you don't want to transplant any infection into someone who's about to be immunosuppressed to prevent the rejection of the organ. And that's a lifelong commitment of the transplant recipient. So we would screen deceased donors and living donors for active infection to exclude active infection, and then would only proceed with a donor operation if the active infection has been excluded.
Yeah, and just talking then about the risks associated here, just take me through some of them, particularly of, transplant recipients to get, of course, or the recipients of the organ around this time of COVID-19, particularly because I understand they would be sort of immunosuppressed, post the transplant.
Yeah, so I mean, even the mere fact of coming to a hospital is a risk in itself. I mean, the hospitals are very good in terms of their infection prevention control, and that's something that each individual centre and all other centres trying to go back to work are implementing to mitigate that risk. I don't think that you can completely get rid of the risk, so the advice is to defer all non-urgent surgery until we have a better assessment of where we are. Transplant recipients are in an unenviable position because they need those organs to survive, to get good quality of life. Only dialysis patients really have an option of being supported, but then they still have to come into the hospital potentially 3 times a week for dialysis. So for urgent transplants, that would still be proceeding with living donors and potentially deceased donors. But there is a big strain on hospital systems at the moment. And all hospitals are struggling to adapt to a new normal and maintain a level of function for their regular patient load with this now increased COVID burden onto the healthcare system.
And David, just expanding on that, I mean, are we seeing more of hospitals just incapacitated or even facing more pressure? Because with some hospitals that have, recorded numbers of patients or even medical doctors who've contracted COVID, they had to close. They had to be then disinfected and decontaminated. This, of course, obviously having a backlog of some of the organ transplantation that have to take place. Are we seeing that more occurring in South Africa?
Yeah, so I would think that the system is under strain, and that's important to realize. And there are staff going off sick, and there are staff who have exposures and then need to self-isolate. So the workforce is a big issue. To maintain a healthy, motivated workforce during this crisis is a challenge for all hospitals. And it can get to the threshold where an intervention has to be taken to suspend service completely. Which is not something that we want to do because of the patients that then don't get any service at all. So we need to try and find the best ways to safely function during this while continuing to serve the patients.
Let's go back then to basics, David, just in terms of organ procurement and transplantation. What does the process then look like generally?
So for a deceased donor, it would come through an ICU. And if the person was declared brain dead, the family would then be approached by a transplant coordinator, and they are really the best positioned people to be able to know what the true risk-benefit ratio is and what the need is, because they get urgent calls out that there's someone who needs an urgent liver transplant in the next 48 hours, and the logistics can assess whether we can accommodate that at that time and try to assist at that point. If there was no suitable size recipient, then potentially the heart transplant wouldn't be available. So there's lots of logistics. So we would want the referrals to still come through for deceased donors so that we can give families the option of supporting and see where the system is able to accommodate, because it's truly a gift if a family makes that bequest and honors the patient's wishes by donating their organs. And we want to make sure as much good of such an act comes. And then for living-related donors, it would probably be more based on what is the need for the recipient, because you are subjecting someone who's completely healthy to an operation. And they're obviously prepared to take on that risk, but we need to assess whether that risk is justified in the current environment. So we would be assessing them all on a case-by-case basis. And a living donor and a deceased donor are all fully worked up for all types of infections to make sure it's completely safe to donate. So a living donor must have a normal life expectancy following the donation operation. So they're already assessed to be fitter than the average population to proceed for donation. And those workups would still be happening. It wouldn't be compromised.
Right.
But basically, transplantation in the current environment is making sure it's being prioritized for the more urgent cases.
All right, well, David,
and there has definitely been a drop-off in the numbers in terms of activity of transplantation in South Africa as a result of COVID.
All right. Well, David, we'll have to leave it at that. Thank you so much for sharing with us, David Thompson, sharing with us there just the organ procurement and transplantation process taking place in South Africa, this amid, of course, the COVID-19 pandemic.